Hello, welcome to my YouTube channel Nurse's Hand. Today we are discussing about some important pharmacology question and answers. Question number 1. Which of the following medication should have an empty stomach? Option A. Baclofen, B. Bromocriptine, C. Eltroxin, D. Tetracycline. If I explain baclofen, it is used to relieve the muscle spasm. B. Bromocriptine is a dopamine receptor agonist. It is used in Parkinson's disease, hyperprolactinemia. Eltroxin is a tablet containing hydrated form of levothyroxine sodium, which is used for the treatment of hypothyroidism. Fourth one, tetracycline. We know it is an antibiotic that works by stopping the growth of bacteria. Here the answer is option C, eltroxin. The reason is the absorption of levothyroxine in the gut is decreased when taking the hormone at the same time as calcium and iron and some food and other drugs. Because of this, patients are usually instructed to take levothyroxine on an empty stomach 30 to 60 minutes before food intake. Second question, which of the following antibiotics suggested for bacterial meningitis? Meningitis, we know it is an infection of the membrane that protects the spinal cord and brain. So the first option, metronidazole, B. doxycycline, C. ciprofloxacin, D. ceftriaxone. Here the answer is option D, ceftriaxone. It is used in the bacterial meningitis. Next question, which of the following antibiotic included under fluoroquinolone? Option A, azithromycin, B. ciprofloxacin, C. amoxicillin, D. tetracycline. Azithromycin is under the macrolide antibiotic, amoxicillin is under the penicillin type of antibiotic, and tetracycline is under the tetracycline class of antibiotic. So here the answer is option B, ciprofloxacin. It is under the fluoroquinolone type of antibiotic. Fourth question, on the use of which class of antibiotic need frequent CNS assessment? Option A, aminoglycosides, B. cephalosporin, C. macrolide, D. monobactam. So here the answer is macrolide type of antibiotic. It's because most common side effect of macrolide antibiotics are headache, dizziness, vertigo, and because of this we need to assess the CNS. The common examples of macrolide type of antibiotic are azithromycin, clarithromycin, erythromycin. Question number 5. Which of the following is not a teratogenic drug? A. phenytoin, B. warfarin, C. isotretinoin, D. heparin. If I explain, a teratogen is an agent that can disturb the development of embryo or fetus. So the question is, which is not a teratogenic drug? Phenytoin is an anticonvulsant drug. It has teratogenic effect. Warfarin also grows the placenta, so it has teratogenic effect. Isotretinoin is a potent human teratogen. It can cause fetal abnormalities. So here the answer is option D, heparin. It cannot cross the placental barrier, so there is no risk for to the fetus. 6. What is the antidote of magnesium sulfate? A. magnesium phosphate, calcium gluconate, sodium bicarbonate, and sucrose. So here the answer is calcium gluconate. Calcium gluconate it's used in the treatment of severe magnesium toxicity with the 10% calcium gluconate 10 to 20 ml IV. So it reverses many of the magnesium induced changes in the body. 7. What is the dilution of adrenaline? A. 1:10, B. 1:100, C. 1:1000, D. 1:10,000. Here the answer is option C, 1:1000. 8th question, which of the following is best drug of choice for amoebic dysentery? Amoebic dysentery is a parasitic infection of the colon with the amoeba, Endamoeba histolytica. Option A, ciprofloxacin, B. metronidazole, C. amoxicillin, D. omeprazole. If I explain, ciprofloxacin and amoxicillin both are antibiotics. Metronidazole also is an antibiotic, and omeprazole is a proton pump inhibitor. So here the answer is option B, metronidazole. It is both antibiotic and antiprotozoal agent. Which of the following drug is advised for chickenpox? A. Vancomycin, B. Cefotaxime, C. Cefazolin, D. Acyclovir. Vancomycin is an antibiotic. Cefotaxime is an beta-lactam antibiotic. Cefazolin is first generation cephalosporin antibiotic. So the answer is option D, acyclovir. It is an antiviral drug used to treat chickenpox. 10th question. Frequent visual examination is suggested for a patient on A. Rifampicin, B. INH, C. Ethambutol, D. Dapsone. Here the answer is option C, ethambutol. Ethambutol use may cause permanent vision loss by induced optic neuropathy.